Very hearty good afternoon and welcome to our session on breastfeeding, the first vaccine for newborns. We are glad to have Dr. Prachi Bhosale among us today to help us explore the topic. Breastfeeding is one of the most important functions for a new mother, sorry. It's the primary process to deliver nutrition to a newborn and is one of the most important activities in the life of a mother and a child. The doctor will help us understand breastfeeding from the point of view in increasing the child's health and immunity. Doctor, now you have the stage. Thank you.
Hi, a very good afternoon to everybody. I'm Dr. Prachi Bhosale. I'm working in Apollo Cradle and Children's Hospital in Brookfield since last 3 years. So today, as we are celebrating the Breast Week from 1st August to 7th August, so this is the breast feeding week is going on. So naturally, very favorite topic of mine is breastfeeding because day to day in our life when we are seeing the newborns are born and we have to deal with the effects and what are the uses or what are the benefits, maybe I will say, of the breastfeeding. It's how to counsel the mother, how to make parents prepared for breastfeeding, not only for the pregnancy but also for the breastfeeding. That is also important because that is the important job of the mother after the baby is born. So that is very important. So that is why we always say that we have to prepare mother for mentally prepared that she has to feed the baby at least for initially 6 months. So exclusive breastfeeding is very important. So why I have chosen the topic as the first vaccine? Because the breastfeeding is really the first vaccine for all the newborns. We do give a few vaccines initially 24 hours of the baby's birth, after birth, but yes, breastfeeding, which we should start, that is we call as a golden hour of baby's life. So when the baby is delivered, within 1 hour of baby's life, we immediately start the breastfeeding. So we just put the baby close skin to skin contact with mother and we start the breastfeeding to 1 hour. We have so many data is there that it shows that it improves the baby's life and a baby's so many, like why we are calling it as a vaccine. So during the COVID timing, we have got to know that what is the use of vaccine, COVID vaccine, and now everybody of us, we have taken the booster vaccines also. So we know that, and this one vaccines, any vaccines which we take, we give to the babies, it produces the antibodies in our body which enhance our fighting capacity or immunity to fight against that particular infection. So that is why we always try to give the vaccines, basic vaccines, which have undergone so many trials, and we just store them properly. And once that vaccines we have given, it is to we expect that baby will fight against that infections. That is why so many infections they have eradicated from our country, like smallpox. Yes, now we must have heard 1979 we have given. Till that time we used to see the cases of this one smallpox, and we used to give the vaccines. But as there were no cases, we have stopped the vaccination for smallpox. After that we are doing so many mopping rounds or pulse polio rounds, if you have knowing that to eradicate polio from our country, because it is also affecting the child's life if at all any baby has got polio. So same way, this breastfeeding is the first vaccine for the baby which we can give within half an hour of the delivery, because it significantly improves the health and survival of the kid, not only for the newborn but also well-being of the child till the age of 5 years. Because till the age of 5 years, baby keeps on falling sick, on and off, cough, cold, because once they go to school, they will they will get surrounded by the infections and all. So when they have so many other kids who are having cough, colds and all, so normally babies will get infection till 5 years. So if you give breastfeeding at within 24 to 48, 24 like half an hour, normally we say half an hour to maximum 1 hour. If it is cesarean, if the mother is in the OT or something, maximum we can prolong for 1 hour. So that golden hour is very important. So if we give that, it is very important that it causes too much improves the health, well-being and the survival of newborn and child. So again, the second very important sentence which I will like to tell you, that it is breastfeeding, human milk feeding is the investment for the life. Very important investment for life. Again, as I told you, why investment for the life? Because it is saving the lives and improving the health of newborn, and also it is very helpful for mother also, that I will just let you know in details. It is also important for social and economic development of individuals and the nation. So That is why we say that it is investment for life. So this is the very important topics, and then I will discuss what are the benefits of breastfeeding and all. So slowly we'll discuss one by one. So as many parents will be asking us, what are the effects of breastfeeding? So what are the effects of breastfeeding? What are the advantages? What are the benefits of breastfeeding? So it is not only useful for the baby, it is useful for mother, it is also useful for family, full family also. Okay, how it is effective, I will just let you know. Breastfeeding is a complete food for the baby. Okay, and it is species specific. We know that cow's milk is for cow's baby, human milk is for human baby. So when the mother's milk is not available, especially in NICU, we do offer donor's milk also, human donor milk. Okay, so it is easily digested. It is well properly absorbed from the baby's gut. It promotes the infection. It promotes the protects against the infection. It also promotes the emotional bonding between baby and mother, and also helps better development of the brain. Okay, so that is very very important. So how this affects for the baby, then after that how it affects for the family, this is very important. So they will ask, with the mother is feeding, why it is helpful for family? Because why it is helpful? Saves money. That is very important, because we don't have to give any outside formula feeding, which is very very costly. If you see, breastfeeding is, if the mother is feeding the baby, it is the purest form of milk, and it is available easily. Baby can have anytime, whenever mama is there, baby. And if the baby is hungry, and that's what mama is, we call it as a rooming practice. That means baby should be always allowed to keep along with mother. So 24 hours baby should be with mother, so that whenever baby is hungry, baby can just ask. Whenever baby cries, mama can get the baby and she can feed. So it saves the money. You don't have to buy any formula feed, or else we don't have to. It also promotes the family planning. Okay, so that is important. It decreases the need of hospitalization, as we saw, because it is the first vaccine for the baby. It reduces the chance of getting infection. So baby doesn't get infection, it doesn't get hospitalized. Also it contributes to the child's survival. Now how it benefits to mother. So this is very important. How it helps, because it helps in involution of uterus. Like during the pregnancy, the uterus has become too big in size. It has reduced. It use because of breastfeeding. It helps the uterus to come down to its natural size, to get back to its original size. Also, it prevents the pregnancy, which I already discussed. For helpful for this one, because breastfeeding causes lactational amenorrhea. Okay, so it also lowers the risk of breast and ovarian cancer. Okay, and it also decreases mother's workload. That is also important. Why it decreases mother's workload? Because she doesn't have to prepare any food other than breast milk to the baby. When baby is hungry, she can breastfeed the baby. Okay, so normally we see that this one, the breast tissue, how it is formed. So it is formed by Yeah, hello. Sorry for the disturbance. Actually, there was some network issues. So yeah, I was discussing about the how the milk is formed. So milk is secreted and ejected. Milk is produced as a result of the interaction between hormones and reflexes. So during the pregnancy, the glandular tissue is stimulated to produce the milk, and there are various hormonal influences also. So there are two reflexes which work for producing the milk. It is prolactin and oxytocin reflex. So what is prolactin and oxytocin reflex? So prolactin is produced by the anterior pituitary. There is one gland which is situated in our brain, which is responsible for milk secretions by the mammary milk secretions by the mammary glands. When the baby sucks, the nerve endings in the nipple, they carry the information to the anterior pituitary gland, which in turn releases the prolactin. That is the hormone. That hormone passes through the blood to the glands and promotes breast secretions. Okay, so that is very important. So prolactin and oxytocin. So prolactin is very important for secretion of the milk, and oxytocin is for ejection of the milk. Okay, so all this oxytocin is hormone produced by the posterior pituitary, the same gland which is situated in the brain, but it is situated behind the anterior part, it is responsible for the contraction. That means the muscles myoepithelium, that is that muscles contraction around the glands, which leads to the ejection of the milk. Okay, so these two hormones are very important, and these two hormones works in well balance if mother is in happy mood, or mother is very much with the baby. If she hears the baby's hearing crying, or if she touches the baby, that it, or else when the baby sucks on the mother's breast, it stimulates the baby's mother's hormones, and the milk is secreted. But if mother is in the stressful condition, if she is not worrying, she has some pain, she is in stress, or she is worrying about something, the secretions comes down, because it is hormonal reflex. So normally we say that mother should be always in the happy mode. Her secretion increases with the sound of baby, thinking about the baby, touching the baby, sight of baby, and when she is in relaxed mode. So okay, so normally many times we don't know which types of milk we have. So when the baby is delivered, mothers will be telling that we have only few drops coming, milk is not flowing enough. So we say that milk should not flow on day 1, day 2, because initially 2 to 3 days, what we say 48 to 72 hours, what milk comes, it is the colostrum. That is very very important for babies brain growth. That is highest calorie, so we have to give that colostrum. Even though it is in the smaller quantity, it is enough for the baby's tummy to get filled. So don't think that milk will flow on day 1 itself immediately. Whatever colostrum, whatever few drops are coming, allow the baby to latch. Once baby latches for 15 to 20 minutes, it's enough for the baby, and baby goes back to sleep. It is required to maintain the sugar of the baby's body. Okay, after that, after 2 to 3 days, the transitional milk comes, which stays for 2 weeks, which is also immunoglobulin and protein content decreases in that milk, and the fat and sugar content increases. After these 2 weeks, the next milk comes, which is the mature milk. The mature milk starts after two weeks. It is thinner and watery, but it contains the nutrients which are very essential for baby's brain growth. Okay, and in that same milk, we always have foremilk and hind milk. So what is foremilk and what is hind milk? So whenever baby is sucking initially for 10 minutes, initially 5 to 10 minutes maybe, that milk is watery and rich in proteins. It has also high levels of sugar, vitamins, minerals, and it satisfies the baby's thirst. So always 5 to 7 minutes when you start the feeding, it will be this one, uh, fore milk, and afterwards the hind milk comes. So what is hind milk? It is the at the end of the feeding, after the 5 to 10 minutes of feeding, it is richer in fat, and it provides the energy, and it satisfies baby's hunger. So fore milk satisfies the thirst, this satisfies the hunger, and it is required for the optimal growth, and baby needs the both fore milk and hind milk. It is not like that if you give only fore milk, baby will be crying only, because it will just satisfies baby's thirst. Baby will be hungry only. That's what 10 minutes if the baby sleeps, again within half an hour to 45 minutes baby will get up, because still baby is hungry, and he will start crying for feeding. So you always have to feed the baby at least for 15 to 20 minutes, completely 15 to 20 minutes, so that baby will get proper this fore milk and hind milk. Okay, so there are total 10 steps actually we do follow in our hospitals to support the mother, support the parents, support the like before going getting discharged from the hospital, we always take care that mother become confident enough to take care of her own baby, and she is confident enough to feed her own baby by her own. So always that is our motto, that we follow proper steps, which we take some mothers antenatal classes also, where we teach mother to how what is the breastfeeding, how you have to feed the baby, how often it has to be fed the baby, how you have to mentally prepare yourself for breastfeeding and all things. So we all teach to the mother so that she gets mentally prepared, and as soon as delivery happens, we always try to get skin to skin contact. So once baby is made skin to skin contact, the maternal bonding improves. The babies, as I told you, that's hormones and reflexes starts acting, and milk starts flowing. So that is very very important. So that is why we have to follow all those steps which are very important for increasing the mother's milk. So sometimes mothers will be asking, how would I know that baby is enough fed, or whether my milk is adequate for that, for my baby? So normally we see that initially 3 to 5 days, babies are allowed to lose 7 to 8% of their birth weight. But after that, from day 5 onwards, babies do start gaining weight, 20 to 40 grams per day, and it increases slowly, so that baby crosses the birth weight by day 10 to day 12 of this life. So that is the first thing. So that we can tell to the parents. So that's what we call the babies after the delivery, that please come. We have to see the baby's weight, and we have to see how many times the baby is passing urine. If the baby is passing urine 6 to 8 times per day, if the baby sleeps at least 2 to 3 hours after taking feeding on mother's breast, at least for 20 minutes, that also shows that baby is nicely fed. Okay, so these are the three things: adequacy of breast milk, how we will confirm, sleeping, gaining weight, and urination. So this is the very very important thing, which all the mothers, new mothers should know, if she is handling the baby all her own, that if the baby is gaining weight, no need to worry. Okay. Sometimes some issues happens with the mother's milk, that sometimes her nipples are a bit cracked, or else if the nipples are inverted, or else sometimes she gets sore nipple, or else if she gets abscess, there is a bit dangerous complication if it develops. That all happens if we don't breastfeed the baby quite often, every 2 hours. So that's what we always keep saying, telling the mother. Initially, if the milk is not there, we do give some medicine which increases the milk, but from day 3, day 4, milk secretion starts on its own, and then we have to stop all the medicines, and we tell that you have to feed the baby every 2 hours at least for 20 minutes, so that your breast should get empty. Because once the breast gets empty, the milk gets again and again filled up within 2 to 3 hours. So, and that too, we should start giving alternate breastfeeding. We should not continue the same breast only on right side. If the mother is feeding, that is not good. Yeah, baby sometimes rejects one breast. That is quite often. That is quite common. Don't worry about it. You always try to feed the baby the breast which he is rejecting also. Otherwise, over there the milk gets collected, and it can cause a kind of congestion, or it can cause the abscess also if the milk is not yet flown out. Okay, so I've spoken about this one, adequacy of this one, and extra nutrition. Yes, so when the mother is feeding the baby, she should be always taking the extra nutrition for the mother. So we are saying during pregnancy, mother should take extra 350 kilocalories, and when she is breastfeeding, she should take extra 520 kilocalories during her next 6 months after the delivery. That means when she is breastfeeding, which is important because it is important not only for her, but it is important also for her baby. Okay, so promoting health exclusive breastfeeding, it is the duty of all the health personnel. So we normally, as all doctors, sisters, we have lactation consultants, we have duty doctors, we have like all our staff is always we always make sure that exclusive breastfeeding in the postnatal ward and in all our nurseries, all mothers should be helped, and we support in establishing breastfeeding. If there are any problems, as I told you just now, all the sore nipples or cracked nipples or something, we do attend immediately, and mothers should be counseled, and we should continue breastfeeding at least for 24 initially 6 months. Okay, so I would like to tell you some kind of important facts which we always see in the breastfeeding. Okay, so during the breastfeeding, if we don't breastfeed babies, what will happen, and if you feed the babies, what happens and all. So there are actually, what is the cost of inadequate breastfeeding? So normally this is very very important, because in India, annual data we have, and in this we have seen that if you breastfeed, we can prevent child deaths more than 1 lakh. Okay, that is very 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 important message, that if you breastfeed the babies within that first golden hour, we can prevent 1 lakh of child deaths Also, the number of child diarrhea during the first 6 months or else afterwards, the cases of diarrhea reduces in lakhs. The cases of pneumonia again reduces in 20 to 40 lakhs. The cases of obesity, if you don't breastfeed the babies, babies do tend to become obese. The cases of obesity reduces by 40 to 50,000. The cases of breast cancers in mothers, normally we will come now. In mothers, breast cancers and ovarian cancers reduces within some 7,000 to 10,000. And type 2 diabetes, which develops in the babies, which also reduces within 80 to 90,000. So that is the cost of our breastfeeding. So breastfeeding, that is why we say it is very, very important, and you have to give it to the baby very, very frequently. Okay, so delayed initiation of the breastfeeding after the first hour of birth is doubling the risk for neonatal mortality. So the very important thing in India, we have observed that 3 out of 5 newborns, they don't get to begin breastfeeding within 1 hour of their uh, life, and 1 out of 2 women is not able to exclusively breastfeed her baby. So this is very sad. Okay, so that we have to change as early as possible, because I told you what why we have to change all this. So that is why we say that human milk is equal to medicine, human milk is equal to vaccine. Okay, why? Because human milk, if you see, human milk reduces the chances of getting breast cancer, as I told you, ovarian cancer, and heart diseases in mothers by 10%. Okay, it also, babies grow up healthier and smarter. It reduces the lower respiratory infection in the kids. It reduces the middle ear infection at least 70 to 80%. It reduces sudden infant death syndrome, which happens in the newborn period, by 50%, and also reduces the IBS, what we call as inflammatory bowel diseases in the kids or children, at least was 40 to 50%. Okay, so if the baby is sick and if we give, my baby is not able to take the suck the milk, we can express the milk of the mother and we can give, and surely the chances of improving the baby is very, very high. Okay, so mother, we also teach, as I told you, in 10 steps we discuss the mother, how she understands that baby is hungry. So once baby is hungry, normally baby will try to look around here and there. Now they will start initially opening the mouth, turning their head here both ways. Then slowly they will start stretching their body and all. Once they are just about to feel hungry, then they will increasing physical movement, their activity will increase slowly they will start putting their hand to their mouth. And afterwards, when they are really hungry, they will start crying loudly, they'll become agitated, and they will become totally red if it is late. That is the late cues. So initial cues only, if you understand, yes, baby started moving their head or they're putting their hand inside the mouth, their rooting reflex, they'll just search over here and there. If that early cues, if you get it, immediately you start feeding, baby will be always happy to feed the mother. If they are very angry, to make them counsel or to make them stop crying will take at least 5 to 7 minutes. And after that, you have to just take the baby near to your chest, quite calm the baby, and the baby will sleep. Okay, then baby will start sucking. In between, baby will take nap, or else in between, baby will take a bit of pauses to breathe, or else it will swallow whatever milk he has taken. So that is very common. So you don't have to irritate the baby during that time. That is very common. Few seconds of pause is always expected. But if baby goes to sleep, you have to stimulate the baby's ear, baby's soles. So you have to tickle the baby so that baby will be awake and baby will keep on suckling. Okay, so look for, whenever baby finishes their feeding, they will just open their hand, and then soft hand, they just open the hand, and that understands, we should understand, they just detaches their grafts, whatever they are grasping on the areola, they just detaches themselves. That shows that baby has fed properly. If the baby is passing urine properly every 4 to 6 hours, if the baby is, initially the motion will be greenish color, slowly it turns greenish yellow, and then after 3 to 5 days it will turn yellowish. When the baby's motion turns yellow, baby might pass motion at least 7 to 10 times also. Many mothers will get scared that baby has got loose motion, but that is normal. Don't have to worry, because passing motion 7 to 10 times, it is normal. When the baby is breastfed, they will pass motion. Every time baby is feeding, they will pass small quantity of motion. That is expected. So you don't have to worry. So normally nowadays many mothers are asking, my milk is less. I think so because baby keeps on crying. I think I can't feed my baby. Can I give? Yeah, I can understand. Mothers are trying from their best that to feed the baby, but still they do ask about formula. So So formula milk will is outside food. Okay, formula food will be always having maximum proteins, carbohydrate, fat, vitamins and minerals. Okay, the immunity which you are going to give to your baby is through your breast milk only. So that is why first and foremost always I will request all the mothers, all the new mothers who are hearing to this talk, that breastfeeding is the best. You have to feed your baby. So why I'm calling it as a vaccine? Because it has so many things which nobody else in the world can give, not even formula, because it has so many antibodies. Okay, antibodies will protect your babies against so many infections. It has so many antiviruses, it has hormones, as I told you, it has anti-allergies, it has anti-parasitic effect and antibacterial. So if the baby gets any infection, yeah, if your baby is on breastfeeding, the chances of getting infection itself is less, and even though baby gets infected, the chances of healing is very fast. Then also it has growth factors which improves the baby's growth. It also has so many enzymes which is important for baby's brain growth. So all these factors are not there in the baby's newborn formula feed. So that is why we have to give baby breastfeeding maximum. Sometimes if the baby is crying, yes, you can give formula, or else if the mother is stressed out, yes, it is allowed. But maximum, I told you, so many good effects, good advantages of breast milk: anti-parasitic, anti-allergic, anti virus, so many which no other milk has. So that is why very important. And you will see the change in the baby's life, the change in the baby's brain growth, if you are breastfeeding every 2 hours. Okay, so percentage of death in the premature babies fed with formula milk is significantly higher compared to the premature babies fed on the human breast milk. So as I told you, in NICU we do offer to to the parents that we can give donor milk. We have all the milk banks where we store the milk, human milk, and we can give it to the babies who are born preterm, or is those mothers who don't have milk. It is, the chances are very rare, but yes, we can offer that to the baby mothers also. Okay, so yeah, effect of exclusive breastfeeding, again I will tell you that it decreases the chances of NEC. NEC is the infection which babies can get, preterm babies maybe, necrotizing enterocolitis, that is an infection of the stomach, intestines. So that chances of getting NEC reduces. It decreases the incidence of malabsorption syndrome. Okay, it also decreases the incidence of infectious diseases like diarrhea, gastrointestinal sepsis, pneumonia, and as I told you, infant botulism. These are all the infection. If at all, if you don't give it to the mother breastfeeding to the baby, it might have. It also decreases the incidence of non-infectious gastrointestinal disorders like inflammatory bowel disease, which I already discussed. It improves the incidence of post-surgical healing of the gut infection. If the baby gets any infection of the gut, if you breastfeed the baby, the chances of healing is very high. I've already discussed about family and mother importance, for the mother, how it is important, and how we have to counsel the mother that she has to be positive. She should always be telling that yes, I can feed my own baby. Whenever mothers say that yes, I can't feed my baby, I don't have milk, always the first primary thing you have to tell to mother is counsel the mama that you can do feeding on your own. You are capable of feeding on your own. All mothers have that capacity to feed their own baby. And if you do that, if you counsel the mothers, yes, mothers' morale we have to improve, mothers' positivity we have to always improve. And once it is improved, yeah, there is no end for breastfeeding. So once you keep on feeding the baby, yes, you can also see the chances of visiting to the doctors will come down, and you don't have to keep on going to the hospitals again and again for some non-specific reasons. You will be very happy, and whenever mother is there with the baby will be always happy. So this time, every week, every yearly, we have some themes for WHO. So this time is step up for breastfeeding. So that's what we are doing, that as I discussed, step up for breastfeeding, educate and support. So we always support and educate all our mothers to breastfeed. So this is from my side. That breastfeeding is very important, which is for the breastfeeding week. So any doubts regarding breastfeeding, or else any doubt regarding anything related to the breastfeeding, you're welcome. Thank you.